Have you ever had a digestive disorder or currently have one? One that leads you to have indigestion, gas, bloating, cramping, pain, swelling? Do you ever wonder, what can I eat? Or you're afraid to eat something because you don't know if it's going to give you some more cramps or bloating or diarrhea? Have you tried alternative options? Have you tried fiber and water, gone and got antacids, maybe even some apple cider vinegar? Even tried a prescription, only to find out you're not getting anywhere. Have you gone on a gluten-free diet, dairy-free diet, soy-free diet, sugar-free diet, or another thing that maybe your medical doctor has prescribed to help you get along? Well, I've been there. I've been on all those diets and didn't have results. But there is one thing that we can do before diet and exercise that can get some relief that you're looking for. If you're tired, if you're having a digestive disorder, you're probably fatigued and tired anyway. So going out and working out ends with more fatigue and, of course, joint pain and more suffering. So what's the purpose of it? And then when you do get tired, what are you going to reach for? You're going to reach for a stimulant. You're going to look for a coffee. You're going to look for a tea. You're going to look for some sort of energy drink. Well, that is a myth. And I want you to understand today what we can do to reverse that problem. Would you like to know what you can do to help with your digestive disorders? Would you like to know what's going to help with your skin, help you lose weight, help increase energy? Well, today you're going to find out what can do that, and now with the knowledge that you have, you're going to be able to tell everyone what you know. I'm Dr. Trites, the clinical director for Doctors Optimum. I've been there. I've been up at night with itching or indigestion. I've been to all the doctors. I've gone through all the diets. I've had weight gain even when I shouldn't have weight gain. I've had a lot of blood work only to find out that that blood work wasn't really worth anything. It didn't tell me anything. It just told me I didn't have a particular disease. So why am I telling you about this today? It's because we know that a proper digestive system equals fuel. And when you have more fuel, you have energy. And when you have less fuel, of course, you have a clogged digestive system, and you end up with all those symptoms, such as the gas and bloating and indigestion, diarrhea, constipation. And of course, if the digestive system isn't working, you're going to have a clogged hormonal system. What this means is you're going to be tired, fatigued, you're going to gain weight, and whatever you seem to do doesn't seem to work. So what works in the digestive system? Well, when the body breaks down such a thing called protein, it makes a little chemical called neurotransmitters, and that's what tells hormones what to do. For example, serotonin is made in the gut, and if it's not broken down properly, you end up with brain fog, memory issues, and concentration issues, and you can also end up with depression and anxiety. So lastly, a clogged digestive system can mean a decrease in energy, of course. You can also have a decrease in immunity, meaning you might get sick more than you used to. So if you have any of these conditions that I've talked about, gas, bloating, indigestion, heartburn, can't seem to get your memory the way it used to be, you might have a condition that we can help you with. There are myths that go with digestion, and I'm going to tell you today it's not your fault. Number one, you need to watch what you eat. You need to get out there and don't eat anything. Well, most people who starve end up gaining weight. There's a reason for that. It's not proper. It's actual myth. Number two, you need to work out more. Well, most people need to work out between 20 and 30 hours a week to get the weight loss and the health that they're looking for. But is it really healthy? At 20 to 30 hours a week, that's a full-time job. Are you going to be fatigued? How are your joints going to look? You're going to be tired and beat up. So that might not be it either. Number three, they'll tell you, well, work out more, eat less. Well, how do you feel? Is that really effective? And then you got the person down the street that you have a little bit of envy on. They go out and maybe don't work out very much at all, if any, eat everything they want, and they still are fit and they look skinny. That's the person I want to be. And that's the person that I want you to be. And there's a reason for that. They have something that you don't have. They have a proper working digestive system, and they have an unclogged hormonal system. So how do we get there? While I don't condone the consumption of sugary foods and carbohydrates and alcohol, even grains or gluten or dairy, even soy, I'm not your doctor. I don't have a blood test to show me that you can take it or you shouldn't eat it at all. So in order to help you out, I have to work harder. We have to come up with something that will work for you without any physical exam, without any history. It starts with my story. About 10 years ago, while in practice, I started having trouble remembering things. One of the things I was always gifted at was numbers. I could just look at a number, let's say a credit card number or a phone number, and it was just there. Well, all of a sudden, it was gone. And once it's gone, I start going, well, wait a minute here. And then I could recognize faces, but I couldn't recognize the person or know their name. I didn't know exactly what I was going for. And then, worst of all, for practice, I started forgetting appointments and appointment times. Let me tell you what that does to a practice or any business that you're in. It's not good. So what do? I need to go find out some information. So I started going to doctors, and more tests, and more tests, and more doctors. And at the end, and the summation of all of it is, well, your memory loss, and now that you have some chest pain and heartburn and some indigestion and bloating, let's stay away from spicy food. Stay away from alcohol. Let's stay away from sugary foods. Let's even take the mint out of your toothpaste. We don't want to have that. And really wasn't getting anywhere. To make it worse, I was told to exercise more. Now, keep in mind, at the time, I was biking to and from work between 15 and 20 miles one way. I was already getting plenty of exercise. And then when I traveled to, let's say, go to a conference, I had to make sure that there was a restroom somewhere. So before I got on a plane, before I got off a plane, even at the conference, I wanted to make sure, where are the restrooms? I was a slave to my intestinal disorder. So now with this internal disorder, I have no energy. I'm pooped. My brain is going the terrible way. And as a doctor, it's rather embarrassing. Because what do people come to most doctors for? They want to find out how they can help with their digestive disorder. Or, in my case, a lot of my patients were coming to me for longevity and anti-aging, and here I was aging right before their eyes. So again, after 10 doctors and a lot of testing, I didn't have any answers. I was told to stay away from certain foods, and then when I do go out and eat, make sure you don't eat junk food or sugary foods. Of course, I was doing that. Make sure that if you're going to have grains, make sure they're whole grain. If you're going to have rice, make sure it's brown rice. And if you're going to have any coffee, make sure you have no fat or low fat creamer or a substitute that goes in there. And if you got to have a pop, make sure that it is calorie free or diet. And so after the more and more symptoms began, I started having chest pains on a regular basis that wouldn't go away. So back to the doctor I go again. Well, and a good doctor that he was, he's like, well, you got to make sure you don't have a heart condition. So after going to the cardiologist, having x-rays, going through an echo, going through a stress test, the cardiologist comes out and says, don't ever see me again, you're fine. But yet I still have this problem, and it's still there, and it's still bothering me, and it's still nagging me. So as a doctor, my mantra is to never stop learning. So what I found out is that 74% of all Americans have a digestive disorder at any given time. That's 3 out of 4 Americans are suffering at any given time. That's pretty high. So what are we going to do about that? It first started to me in reading labels, but I found out that there was a lot of misleading information on labels, and below you'll have the ability to download our free handout for labels so you understand what in the heck you're getting into. As a former athlete, and luckily I got to run in college, we were told and we thought we were educated on how to exercise without getting over-fatigued, overworked, over-exercised, because that can lead another direction, and what foods to keep in the body. It wasn't like I wasn't doing anything. Occasionally I'd go out with some friends and have some food, maybe a drink here or there, but I wasn't overindulging. But yet, here I am, working out, eating right, still gaining weight, still losing my mind. What's going on? But I don't have any medical test to tell me what's going on. So through my research, I found out that a lot of the grains that we have actually have a whitening agent in it that really is a poison. And the rest of the world has got rid of it, but we don't seem to have those type of legislation yet in the United States. Furthermore, this diet pop that I'm supposed to have is actually more of a problem. So most people drink diet pop because they don't want to have the calories and they don't want to gain the weight. The reality is artificial sweeteners actually cause you to gain weight twice as fast as the high fructose corn syrup or regular fructose that's put in. That seems a little odd, but that's really the reality, and that's what the research is showing. Furthermore, if your waist is gaining, your increased risk of Alzheimer's goes up higher and higher each year. Keep in mind, Alzheimer's runs between 150,000 and 200,000 a year, so whatever you have to give to your children as far as when you pass away, it's going to be eaten up in any type of condition. Yet, this is what I've been told. This is what I went to the doctors for my information, trying to say, okay, I'm the patient here, and this is the information that I receive. It was getting a little bit difficult. So how does an artificial sweetener affect your waistline? It shouldn't. It's artificial, and it's not sugar. Well, it gets into your body and it kills something called bacteria. Some people might call it a biotic, a probiotic, your flora. It kills your normal flora. And in the event, you end up getting something called yeast. Normally speaking, you have 80% flora, 20% yeast. It's in balance. But when you get aspartame in the body, or sucralose, or any type of artificial sweetener, it actually feeds the yeast and kills the bacteria. So now we have a ratio problem. The ratio now comes up in favor of the yeast. What else can cause a yeast problem? Well, we take certain medications, and in particular antibiotics. They're there to kill your pathogenic or deadly bacteria and make you healthy again. Problem is they overkill and they kill your own flora. So then you end up with more yeast. Sometimes coffee, tea, too much sugar in the body. Let's say you eat sugary foods all the time, and other food additives can cause an imbalance. So when there's too much yeast in the body and you have, let's say, a sugar drink or even aspartame drink, sucralose drink, something with artificial sweeteners, or a sugary food, it's like pouring gasoline on the fire. The yeast goes nuts. It multiplies and you end up with a particular set of symptoms. For example, you could have fatigue, brain fog, memory, concentration, sensitivities to food, chemicals, allergens outside, a decrease in libido, upset bowels, toenail fungus, gas, bloating, rectal itching, yeast infections, bladder infections, thyroid disorders, whether that's hypo or hyperthyroid, irritability, depression, anxiety, decreased immune function, meaning you get sick all the time, and learning disorders such as ADD and ADHD. Seems to be a lot of things that are going on with yeast. So when yeast gets in control of your body, it essentially hijacks your endocrine system and hijacks your hormonal system. And so it's not your fault that you decided that, I really need to have a pizza and pop tonight, or I need to reach out for something, and we call it the SSLs. Sugar, salt, fat. Go to any vending machine, the food world knows it. They know what you're craving. They know what's going to sell. Sugar, salt, and fat. That's how they get your money. But at the same time, if you have some of these other symptoms, you may be just feeding that yeast and getting into another situation. So what is a food addiction? It's an addiction. But is it your fault? Nope. It's endocrine. It's neurochemical, or that yeast has hijacked your hormones. And the reason that's happened, you have something that touches your lips, touches your tongue, and it's excitatory. MSG is excitatory. Artificial sweeteners are excitatory. Sugar is excitatory. They light up the brain and it causes a response you have to have. This is why it's very hard for people to overcome addictions. Even when they're very, very disciplined, the success rate on addictions is very, very low. Well, if the yeast is telling your body, I have to crave it, I have to crave it, I have to get it, what's the chances of any type of diet going to work? It's very, very slim. Hippocrates once says, health begins in the gut, and here's why. So if there's an abundance of yeast in your gut, when it has food, it digests it. Does it digest it the same way as a normal flora or bacteria would? No. So you end up with impartially or partially digested particles. Well, the body may sense that as foreign, and that's how food allergies evolve. Sometimes these particles get into the bloodstream. There's a term called leaky gut, which is not very professional, but technically permeable membrane, where these impurities or unbroken down food substances get out into the bloodstream. This is how a gluten sensitivity, not a gluten allergy, a gluten sensitivity starts to evolve. And of course, these can get out and they can head out to the joints, cause joint pain. So again, it's not your fault. You've been misinformed. So if you have a yeast condition, it's probably going to decrease your immune system, but what do I want you to do? What are you to do? How are you going to resolve this? Are you going to have to give up everything? No more coffee, no more sugar, no more soy, no more dairy. No, I'm not going to suggest that. While I think you should eat those in very small and minute quantities, you don't have to give them up. And here's why. If you have a true yeast condition, it's probably going to take you 4 to 6 months, maybe even longer, to actually starve the yeast out so they start to die. But then we still have another problem. Will our bacteria that's in there, our normal flora, probiotics, will they have enough of a boost to be able to grow and to set up shop so that we're back in balance again? I'm not sure. 4 to 6 months is a long time to have a result. So we don't suggest the starvation diet as a yeast solution. The other thing is, most people think, well, you know, if I take out sugar and I take out this, I can still have alcohol. Well, not quite. In the bloodstream, alcohol becomes a sugar, which of course feeds yeast, and then if the yeast gets fed enough, it can actually eat off your normal bacteria, which means the yeast goes a little faster. Again, gasoline to a fire. So we try to stay away from alcohol, as well as sugar, as well as coffee, as well as any type of artificial sweetener. So what's our solution? Well, if you have acne, you might go to a dermatologist, and you might have a soap or a solution or an antibiotic. If you have indigestion, you might have tried antacids, you might have tried apple cider vinegar, you might have tried a myriad of things to try to get the indigestion to go down. If you have weight gain, you might try working out more, eating less, eating better, eating more protein, eating no carbohydrates, all those things. Well, these are all symptoms. And in order to get to the cause of something, we need to get a solution. We need to get to that cause. So symptoms aren't quite the solution. They may temporarily help things, but we need to get to that solution. So we want to get into balance. And balance is the key when it comes to yeast and bacteria. Again, it should be roughly speaking about 80% bacteria and 20% yeast. In the past, you may have had a probiotic, and it may not have worked for you. But I'm going to give you a reason as to why that probably didn't work. Number one, there are 297 clinical studies on humans when it comes to probiotics. And of those clinical studies, they came out with 12 strains that are beneficial. And of those 12 strains, you need to have 7 in there to work. 7 of those 12, not 6 plus 1 other one. And the reason that is these 12 beneficial bacteria are there in force, and they do a lot of good for your immune system, for your health. And if you add a different one, this strain plus this strain might end up with a strain that we call a subspecies or a different type of species that may actually be what's called pathogenic. It's not good for you. So it has to be these 12. And it has to be 7, at least 7 in these 12. When I did a review of the market for probiotics, there's roughly 6,500 to 7,000 products that are out there that say they have probiotics in them. Of that, less than 1% have 7 strains. And even less than that have 7 of these 12. The other part of it that just kind of gets everybody else out of the way as far as when it comes to probiotics, it has to have a delivery system. What that means is when it goes in your mouth, does it get where it's supposed to go? So if it's a capsule or tablet that is easily dissolved or breaks down in the stomach, it's probably not going to make it to your digestive system. So we want to have what's called a time-released or a DR capsule, delayed release, so it gets starting to break down in the stomach and it delivers where it's supposed to, which is in the intestines. If it has to be refrigerated, it's probably not very stable. How is it going to pass the stomach acid? How is it going to pass the heat of your body if it has to be refrigerated? It's already decaying. What about liquid probiotics or gummy probiotics? Probably the same problem. You take them and they're not going to make it past the stomach. What if it has one big strain of probiotics? Probably not going to get past the stomach. And that's when we come to the next myth. Well, we can eat a lot of yogurt to get a probiotic strain, or maybe I can eat sauerkraut or kefir or something like that. Again, one strain, but it does have the ump. Let's talk about yogurt for a second. In the 1980s, if we saw, let's say, a political event on TV that was recorded or a sporting event, almost everybody was thin at the time. And if you were born, let's say, and you're in your 20s right now, you probably don't know a lot about the 80s, but there are a few video clips have nearly everybody was thin. There was a few obesity, but it was there. Well, now you're told, in order to lose weight, in order to get your biotics and everything set, you should have yogurt. Let's talk about yogurt. The current yogurt, if it has sugar in it, has about 29 grams of sugar. Well, remember, sugar feeds yeast. And if they've taken the sugar out to make it healthier for you, they've added an artificial sweetener. Again, artificial sweeteners feed yeast. So the American Diabetic Association and the American Heart Association have agreed that you should have between 5 and 8 grams of sugar a day. Well, if one of them has 28 grams, that's way too much. And if it has too much of that, of course, it can lead to diabetes, and most diabetic conditions end up being a cardiovascular problem. So that's not a good idea. Or it has one strain. Keep in mind that yogurt has one strain. It's not very hearty, so when it hits the stomach acid, it's pretty much eaten up. And that's kind of the way with most of those probiotic shots or the gummies or a liquid probiotic, or take this multivitamin, it has a probiotic sitting on it. Not exactly. It doesn't work like that. So I'm going to give you 3 criteria that you have to have for a probiotic. Number 1, It has to make it past the stomach. No matter what's in there, it's got to get there. And if it doesn't, it's pretty much useless. Number 2, at minimum, has to have 15 billion cells. That's your dose. Now, it could be broken up into capsules. Let's say you have 2 capsules of 7.5 billion or 3 capsules of 5 billion. But at minimum, the dose, the oomph, the power has to be 15 billion. Number 3 has to be 7 of the 12 strains. So we've really limited what's out there and what's possible. So now I'm going to give you some just research that randomly came across. In 2007, the journal Pediatrics said that, hey, women who were breastfeeding and taking a probiotic, their children slept better and didn't cry as much. Something of interest. 2009, again, same journal Pediatrics said that probiotics are as good or coming along as prescribing an antibiotic for infections on children. Keep that in mind. They're thought to be the next superfood, or, when antibiotics were found and discovered, penicillin was a great thing, especially in the, World War II. Without it, so many of our American soldiers would have passed away. But now there is a change. Probiotics are looking to be as good as that discovery. The 297 clinical studies on humans with probiotics were to evaluate blood sugar handling, obesity. Does it affect diabetes? Does it affect memory and concentration? Does it affect food sensitivities? I'd like to introduce you to a product called Probiotic Plus by Doctor's Optimum. This product has 30 billion probiotic cells in each capsule. It also contains 9 of the 12 strains that are necessary and researched on humans. We want you to have results in days, not weeks. We don't want you to sit around and go, is it working? Is it not working? We want to see a result. We know that our dosage is 4 times, sometimes even 10 times higher than most of the doctors that we have gone and asked about or done a survey in our area that give probiotics. 4 to 10 times. Why? Because they don't know what you know. They don't know what capsules get past the stomach. They don't know the dose it has to be in. They don't know how many strains it should have, or that if their strains are actually creating a strain that's not there. Our probiotic is in a vegetarian capsule. It's dairy-free, gluten-free, soy-free, sugar-free. It's kosher accepted. We do testing through third party to make sure that we don't have an inappropriate strain that gets in there, so that what you get is what you're buying. Our probiotic is in a vegetarian capsule. It's dairy-free, gluten-free, soy-free, sugar-free. It's kosher accepted. We do testing through third party to make sure that we don't have an inappropriate strain that gets in there, so that what you get is what you're buying. For you watching this video today, Probiotic Plus retails for $89.99. But for today, it's going to be $49.99. That's $1.60 a day, roughly. Well, how much do you spend if you go out and you buy organic food or gluten-free food, or you have designer coffee? If you have any of these symptoms, do you not go get over-the-counter medications or supplements to try to help this out? $1.60 a day is a pretty good offset. We want you to take Doctor's Optimum Probiotic Plus for 60 days. We have a 100% money-back guarantee. If you don't notice any symptom changes, you don't notice that you're less bloated, you don't notice that you're losing weight, you don't notice that you feel better, that your mental acuity or your memory is increasing, we want you to feel something. So how do you order? You go to our secure SSL server, which is 128-bit encryption, so we're secure with how we grab your information, and your product will ship between 1 and 2 days. Keep in mind, investing in your health is your best return on investment. So what happens if you don't buy a Probiotics Plus today? Probably nothing. But if you have some of these symptoms, you might be leading into bigger conditions such as diabetes or cardiovascular disease, and you just may not feel well. So I'm glad you stuck around, and I hope we've provided a solution that you can understand and easily share with everybody else. And we want to hear from you. We love hearing from our clients. I want to know if you're sleeping better. I want to know if your libido's better. I want to know if some of your numbers that you maybe when you go to your doctor are better. I want to know if the gas and bloating is better. I want to know if your fatigue and energy have gone in the right direction. We want to know. Once again, I'm Dr. Trites, consultant to Doctor's Optimum. It has been my pleasure to bring Probiotic Plus to you and my family, and I hope that you will enjoy it. All my best, and be well.